Do you have skin cancer? Have you ever been treated for skin cancer? Hi, my name's Nancy, and that's what the focus of this video is going to be, because I have that Irish skin that is not that great. And I have been treated for skin cancer. I've had, let's see, 4 skin cancers removed. One of them on my face was the Mohs procedure, M-O-H-S procedure, where they take a layer of skin off and then they go right then and they test it for cancer cells. And then they take another layer, they test that for cancer cells, and they keep going until there's no cancer cells in the layer that they take. So you can have quite a bit of skin removed. I do have a scar here, but I'm sure you can't see it because the doctor did a really good job. But I've also had cancers removed from my arm, my back, and those I just went to a regular surgeon and he cut it out. So anyway, I have to see the dermatologist every 6 months and feel like a bug under a microscope to do full body checks. And I don't mind at all because I'm so thankful. My dermatologist looks like she's 15 years old, and I know that's my 70-year-old head, but she's actually not. She's a very, very efficient, professional PA, and she has helped me a lot. So I love her. But she's also beautiful and skinny with no Mars on her skin. So it's a little, I don't know, I feel like I have all these skin problems and she's pretty perfect. But so anyway, I just went for my appointment for my skin check, and they found several areas. Right here, they did a biopsy. So I'm waiting for that to come. And they froze a couple little things here on my head. And the main thing is right here, I don't know if you can see it on my face, but I've been treated for this in the past. They did a biopsy. It's not skin cancer, but she said it's a precursor to skin cancer. So she wants it to be gone so it doesn't ever turn into skin cancer. And I'm with her because I don't want to have that Mohs procedure so close to my eye. So anyway, this is the second time she prescribed chemotherapy cream. The first time I did it for 2 weeks, once a day, and it did go away. But now it's back. And so I have to do it a second time, twice a day for 3 weeks. And it's chemotherapy cream. I have it here, fluorouracil cream. I don't know if the camera will pick it up. But it's easy. I put it on a Q-tip and I do a larger area than the spot is. And hopefully it'll be gone. However, I will tell you that you don't look too pretty after a while because you get very irritated, red, bumpy, kind of nasty looking skin where you're treating it. And I just started it yesterday, so I'll take you through my treatment and show you what the chemo cream is going to look like, the treated area. I've done it before and it didn't look so great, and now I'm doubling down on it, so I'm sure it's going to look even worse. But disclaimer, I know that this is not anything in the scheme of things, and I don't mind doing it. I'm happy that I'm being treated for it, and I'm thankful, and I'm sorry for any of you who are dealing with much worse things. I am aware of that. The other thing I wanted to talk about was how I mentally prepare myself and get through things like this. When I went to the dermatologist, I initially said to her, which I am aware that I'm a little bit spoiled, okay? When I went to her, I said, I have the worst skin ever. I mean, you probably don't even see people with worse skin than me. And then right away, I said to myself, because I do talk to myself, and I said to her, but I'm very fortunate and thankful that I have skin. And I know that sounds weird, but there are many people that are burn victims or any kind of thing where they lose their skin. And so that's how I try to look at things. I'm very, very fortunate. Several years ago, I had something called branch retinal vein occlusion in my right eye. And I had to see a retina specialist and get eye injections for several years. And that was kind of scary. The first time I sat there and he was going to stick a needle right in my eye. And I'm telling you, I was scared. I was sitting in the chair waiting for the doctor to come in, stick the needle in my eye, and I said to myself, pull up your bootstraps. Like, this could be a lot worse. You could be getting your leg cut off. And that made me feel better. And then I prayed that God would have an angel stand on either side of me and take away my fear. And he came back in the room, and I'm telling you, I was still a little, apprehensive, but I wasn't scared anymore. They stuck that needle right smack in my eye, and it really didn't hurt. It was just weird. So anyway, I kind of psyched myself out for things that are like that. I really just wanted to tell you about the chemo treatment that I'm doing on my face, and I thought maybe some of you might be interested to see how that goes. It's not going to look too great, but I'm going to take you through it for the 3 weeks. And let me know if you have things like that that are happening to you, and how you feel, and if you get scared, and what you do when you get scared or apprehensive, because I'd really like to learn from you different ways that you handle your fears and your aging and your retirement. I'm very interested in that. And if this is something that you're interested in, I would appreciate if you hit the subscribe and like button. And I'm very, very thankful for anyone that watches my little video. As an afterthought, we're having that big storm, and so far we have 7.5 inches built up. We live in New England, so we're kind of used to snow, but this is a big storm. And until I see you again, I will be embracing my retirement, and I hope you will be embracing yours. Thank you. Bye.